Hello, everyone. With me here today, we have our amazing, beautiful, wonderful Dr. Sarah with us. Dr. Sarah, please, can we meet you, ma'am?
Okay. Hi everyone. I'm Dr.
Hi.
Sarah Michael-Duja. I'm a medical doctor. I'm a family medicine resident in training in Bowen University Teaching Hospital, Ogbomoso in Nigeria. I am a graduate of the same institution. I'm also a pastor's wife. I'm a mother, um, baker as well, and also a mentor to younger ones. Yeah.
But it's so nice to meet you, and would like to know more about you as you go on this podcast. Firstly, I would just like to ask that what inspired you to pursue medicine?
Well, what inspired me since I was a child, I just wanted to be a doctor, really. I don't think there was any, some people have maybe doctors in their families and they will say, oh, I want to be like Uncle So-so, I want to be like my daddy and all of that. We don't have any doctor in our family. I'm the first doctor in the family.
Wow.
So, but I think in church, we had this man, my maiden name is Olorun Toba. So we have one doctor in church and he used to lead the church at the time. So he was Dr. Olorun Toba. So I think seeing him, what he modeled excellence
Mm.
in his career and also in ministry. And I think I saw that as a child. Maybe I can't say maybe I couldn't say exactly that that's what I saw, but I just knew that I wanted to be a doctor and I think I was smart for that at my age. Yeah, just wanted to be, kids now. What do you want to become? I want to be a doctor. But I remember having that man's picture. He used to inspire me. Yeah, inspired me a lot as a child.
That's very amazing. So, I would like to ask that, looking back, what do you enjoy most about medical school?
Hmm, medical school.
Yeah.
Finding something enjoyable in medical school is it's a bit of a challenge because I remember especially in the early days I was very very active in the chapel. I was very um
Mm.
active with so many chapel activities and all of that. I was into devotion. So I barely had time for myself. When I was in school, I didn't have time for myself. Monday to Sunday was packed. I mean, was so packed.
Wow.
I didn't engage in extracurricular activities in school. Even my business that I started, I didn't start it in school. I didn't start training in school. I didn't even have interest because my mom was a caterer. I didn't have interest in all those things. So I don't think I really have anything that I can pick on right now that was fun. Maybe having my classmates around because I remember that after school, anytime I'm passing around the hostel, I would just look around and be like, oh, I remember when my classmates and I were here. But now looking around, I can't see them anymore. We all see
Yeah.
ourselves online now. So maybe having familiar faces around sometimes. Yeah.
Yes, that's true. That's true. Now I stay with my classmates. Now hostel, I'm a 500 level, so now we've moved to
Mm.
a hostel where we are now together. So I would like to ask that, are there any pivotal moments that have shaped your path in your medical career?
Yes, there are. So while we're preclinical, in the preclinical arm, we had to do an intercalated program. And while we're doing that intercalated program, there's this seminar we'll do before we now do project and all of that. So I was told to go and choose a topic. And I searched, I was looking for something different, something unique that I wanted to do, but I didn't get. So I went to meet my supervisor and he suggested something to me. He said, why not do physiology of aging? And I said, okay, physiology of aging, I'll do that. I'll take a seminar presentation on that. And while I was doing my literature search, I found that aging is something that is very interesting, how people grow and just become old, how the body changes, how everything just becomes different. And from that point onwards, I developed this interest, this love for older people. And when I graduated, I already decided that I'm going to specialize in care of the elderly. So that singular decision by my supervisor in preclinical days already gave me something like a direction that has helped me up until now. In fact, that's one thing that I'm pursuing till now. My program currently, everything I'm interested in, I just want to take care of old people. So that
Wow.
I think it was pivotal for me.
Wow, wow. That's very profound and it's unique. We don't really see much people say that they want to go into the specialty of caring for the old. That's very unique. Thank you for sharing that with us. So I would just like
Okay.
to know, like, you've been in Nigeria, you've been having your practice in Nigeria so far, and like with the wave of Japan now, which is something that we see, but you decided to stay. So we'd just like to find out, like, what has your practice been like in Nigeria so far? The highs, the lows, the in between, everything. We just want to, whatever you would like to share with us.
Specifically in Nigeria, the interesting thing is that yesterday I was on call over the weekend, and we had some people who couldn't make it, some patients who couldn't make it. And at a point I sat down and I was like, I felt bad for them
Mm,
because I think some of these things, if they were in a better climate, maybe some of them wouldn't have died. But it is what
yes.
it is. We have limited resources in our environment, and that is not encouraging at all. I was unhappy when I thought about all that. We did what we could at the time, but and then the fact that a lot of people don't know better, they would have gone around to chemists and quacks, and they would have given them all sorts. And then they'll come
Yeah.
to the hospital with complications. So seeing people come in at this terrible stage is not encouraging. Nigerians generally have a poor health seeking behavior. Beyond the fact that we are in a low resource setting, in our environment here, people have poor health seeking behavior, and that impacts greatly on their health. Okay. And then about the highs, well, I'm just happy that I am here. One thing that is big for me is finding fulfillment, being happy with what I do. And I have that where I am at the moment, because this is where I feel this is where I should be at this stage of my life. Maybe tomorrow I'll be somewhere else. Maybe I'll be,
Yeah.
no,
Yeah.
right now, knowing that I am right in the place where I think I should be, where God wants me to be, doing what I feel makes God pleased with me. I think that's very important for me. Being in Nigeria also has, especially in the facility where I am, I've met some amazing doctors. One of them is my consultant. I'm currently in orthopedics posting. I'm doing my senior orthopedics posting, and my consultant is very innovative. He was telling me about how he just develops certain things to improvise. He just improvises for a lot of things. For some people that we could have done an amputation for right away, even in better climes, when you see the degree of injury, you just be like, nah, this leg is going. But he would take a critical look at the whole thing and be like, this man is poor. He doesn't have money. He shouldn't lose his leg. He's a manual worker. Let's do something. And then instead of referring to maybe a center where he would spend millions of naira trying to fix the leg and he might even come back with in a worse state, he would just sit down patiently, pray, look
Wow.
far and wide, try to find how to solve this person's problem. Let me tell you a story.
This
One of
one.
the days when I was on call, this was last year. I was on call last year and there was a road traffic accident. So this woman came in with the ankle was like separated from the leg. So you can
Wow.
literally see the ankle joint out. The foot was separate,
Oh,
but it was just like some skin. And I think they actually stand on that was just holding that leg. I saw that
wow.
leg, the foot, and I saw everything. I was afraid for the woman. I was like, well, this foot might go, we might just have to let this foot go. But I told the woman, I said, Madam, please hold on. Let me speak to my consultant. And I called him. He said, well, don't be too eager to take off that foot. Just hold on. Just arrange the leg back anatomically, just do whatever you can. okay, and then rest the foot, put the woman on the ward. If that foot will survive, we will know in the next few days. And it happened. I went to the ward a day or two after. I saw that foot. There was no gangrene. The other anastomosis already opened up, and then the foot was doing fine. So he was able to now operate the woman subsequently. So I saw that woman on Friday. That was like 3 days ago. Yeah, I saw her about 3 days ago. I saw that woman walking. I didn't even know she was the one
Wow.
until she told me that, you see, do you remember this woman? And I was
Oh
like,
my.
what? I looked at the scar on her foot. That was what reminded me that, oh, wow, I
Wow.
remember this woman. She almost lost her foot, because of the very terrible accident. Working in this environment, yeah, might not be the very best because it is a very low resource setting, but it
Yeah.
has opened up my mind to see that even when resources are scarce, we can be innovative and we
Yeah.
can give our best. Okay, it
Yeah.
makes us even think
Mhm.
how can we help others? Because that's one thing medicine is about. It's about helping other people, um, giving our best giving our best, giving our all, just to ensure that people get better, that they have a better life. So, yeah, this environment offers me that. That's okay for me.
Yes, 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 at the moment, that is the
Yeah.
thing at the moment. Yeah, it's so nice to hear that we have very amazing doctors that will go above and beyond for their patients. And I wouldn't even say that it's the pay that is kind of motivating them. Yeah, the pay may, but I think it goes beyond that. It goes, shows the kind of act of service that they have. Like you said, it's about helping people, and it's very nice to see that we have doctors like that. So that's
Thank
very
you.
wonderful. Yeah, and I would like to ask that if you'd like to change one thing about the Nigerian medical practice, I know there are a lot of things to change, but if we just pick one thing to change about Nigerian medical practice, what would it be?
One thing I would like to change is our seniors, our leaders. I want them to care more about the younger ones. Yeah, things might not have been easy when they were in training, but I think it's not needed to be toxic to one another. You see that toxicity in medical field, it's not needed.
Yes,
So if
yes,
there's one thing I want to change, it's to create um a warm environment, a friendly environment where people can learn. The interesting thing is that this is one of the reasons why I came back to Bowen for training because growing up as a student in that all these toxicities and all those things I hear about other institutions, we didn't have it. Probably because
wow.
we are private and we are a
That's
Christian
it.
institution.
Ah,
Being a Christian institution is also a big deal for us.
yeah,
So all those things we really don't see them where in this place. Of course, there are other things that go on that may not be so exciting, creating an enabling environment. I remember there was a lady, she was a medical officer, and then she came in and one of the consultants walked into the consulting room, and then she jumped up from her seat and was trembling. And he was like, "Oh, sit down. It's shaking it down.
we
It's so
start there.
strange. It was so strange to her. Like, well, can this kind of thing happen? Where I work is a place where the CMD can walk into the emergency and you will not know
Wow.
because there's no entourage, there's nothing. Everybody just lives this just very simple. So enabling environments, that's what took me to that. An environment that is not toxic. People will thrive, people will do better when they know that there is no fear. Fear cripples. I hope we know that fear has this crippling effect. But when there is no fear, people will blossom, people will do well. Okay, so I believe that Nigerian doctors can do far better than we are doing, but we need to have a toxic free environment.
So I actually look forward to having a warm teaching, enabling environment for medical school. Like I agree 100%. we need to have that. And I think it even goes beyond just medical school because of the fear of speaking out, because we know that, okay, the response we're going to get is going to be crippling. Like I said, I think it even goes
Yeah.
beyond our medical school, and we now get difficult to actually speak out when we go out just because of the way we've been just because of the kind of environment we've been in and
Yeah.
like that.
Permit me to cut in. I just remembered one experience I had during house job. Coming from um where I schooled, our consultants, we talk to them, we have access to them, we scrub in for surgeries, we gist and all of that. And when I went for house job, I was posted to pediatrics. That was where I did my first posting. I didn't even know the woman. She just came in, and then when the senior registrar told me to go and introduce myself to the consultant in clinic, so I met her. She introduced herself, said her name, and then I said that is she. I now asked her a question that is she related to so so so, and then she was like, yes, this person is. Then my SR was looking at me like,
Yes.
you get liver.
Yes. That's a
That
usual.
was so bold. How dare you
Yeah.
ask a consultant a question like that? But honestly, I
Yes.
didn't know it was a thing because I
I
was not brought up that way. So it's having an enabling environment helps to boost confidence as well. Apart from eliminating the crippling effects of fear, it also helps to boost confidence.
yes. Yes, I agree with that totally. Yes. Thank you so much. That's
You're
it. I would
welcome.
like to move on and ask that what has been your standout highlight in your career so far?
The highlight of my career so far, honestly, at the moment, I don't think anyone readily comes to mind, but okay, making progress in the right direction. I think that's what stands out for me at the moment, making progress in the right direction. It's such a big deal for me. And
Yes.
every day seeing that the things I truly desired and prayed for at one point or the other, I'm living in the reality of those things. Yeah, gives me joy. So that's
Yeah.
like a major thing for me right now. Maybe when
Mm.
I pass my fellowship, I would say
Yeah.
maybe this is a very high point for me, but currently we're still in the process.
Yes, yes. I think that's something we are big on in Excellence in Medicine Network, where we have a goal and we are working towards it constantly. So,
Yeah.
yes, yes. Yes, I want to ask that. Okay, I would like to ask now that has there been any setbacks, low points that you've had during your medical journey, and how did you navigate through it?
I'm trying to be very careful right here because I don't want to say it's a setback because it's also a blessing. And I know
Mm.
that in due time I'm going to catch up. Okay. So I passed my part one 2022. So my timeline for residency is that I'll finish residency in 2025. Right now it doesn't look like it. First, I looking forward to next year.
Mm.
I planned to finish up this year, but along the line, I got pregnant and I had my baby, and it was like 2 years of my life was on hold. I didn't have interest in anything. I was just dragging myself. In fact, at work, I was just when you just do rinse and repeat, I was just going every day, like just going, just going, I think that's one thing that sometimes when I think about it, I'm just like, oh, doesn't really excite me. But yeah, having my child is a big blessing. So I can't really say that's a setback. It's just that my goalpost has shifted. That's how we say it in
Yeah,
EIM. My
yeah.
goalpost has shifted. The timing of that goal has shifted. So that's it. Yeah.
Yes, yes, yes. That's something I think that's one thing that I think one of our doctors in Excellence in Medicine Network, she would say that she discovered that she was a woman in medicine at the point when she got pregnant. So I would say that's something that our male counterparts will not actually be able to relate to, or maybe necessarily have that kind of setback in quotes. But as women that we are, and the fact that we want to also become a mother too, we should. So that's something that I think most of us will probably experience at some point in time. I'm
Yeah.
grateful now that you shifted the goalpost, like you said, and you're still moving towards it. Well done. I think it takes a lot of strength to actually come back, like to medicine, to come back, to still be motivated, to still keep on going and all. Well done, Dr. Sarah.
Thank you. And I want to share one with you guys. I've not even told Dr. Jimmy this. But, I submitted my proposal, and for over 2 months, I didn't get a response from the college. I had to reach out to them. And today I got a response.
Well,
My supervisor called me. I'm being too excited for me yet. So my supervisor called me and said, "Oh, doc, check your mail. You have a mail." I said, "Okay." I checked it. He said, uh, that when I check it, I should come to his office. I opened the mail and I saw it. I didn't even understand what I was reading at first. Like, what's going on here? What's going on here? So there were two assessors. One felt, oh, my job is okay. Ma'am, my proposal is okay. The other person just had a lot of things to say. And in short, I have to resubmit before they can give me a go ahead. And I was just thinking about that. Normally, I would shed a tear or two, like, oh, why is this after all the delay, after wasting time and all of that? Now, I didn't get a direct go ahead. I have to still work on this thing. And who knows when they will respond to me again, you know. But I don't look like somebody that had that kind of mail today, do I? So,
no,
um,
you don't.
yeah, so one thing that I'm learning is to always see the brighter side of things. They want me to do a better job. Yeah, I'm going to do it, and I'll do it
Wow.
well.
Yes, yes, yes. Thank you so much for sharing that. We're
You're
very
welcome.
encouraging.
Yeah, so if
So,
somebody is watching this podcast or listening anywhere at any time, and maybe you just got a report that is not so great, just remember that the person talking to you right now, also had
mm,
a not so good report today. Yeah, but she's still smiling through it,
yes,
looking at the brighter side of things. So you can smile through it too.
yes, yes. Thank you for that. Yeah.
You're
So,
welcome.
piggybacking on that, like with this experience now, and just your career journey generally, how would you personally define success? Yes, yes, yes.
Well, I think success is generally said to be achieving one's goal. Yeah. If you
Mm,
can meet up with something that you have set to do, you say you have success. Yeah. But for
mm,
me, considering my values and everything, I would say my own success is measured by how fulfilled I am, how happy I am to be where I am, doing what I am doing. Okay.
mm,
I just look at my life and I see that these things were prayer points in the past. And where I am right now, it's an answer to those prayers. So I think God has helped me. It may not look exactly the way I want it to be, but God has been faithful. For me, success is measured by how fulfilled I am. You know, looking at my previous results with my current results, is today better than yesterday? If today is better than yesterday, then I think I'm making progress,
yeah,
being fulfilled, and being where I desire to be is something I
mm,
count as success for me, because I don't think there's anything greater than that. Meeting all goals without that internal feeling of or satisfaction that I think I'm doing well enough. There's no success in that. You might achieve all
yeah,
your goals, but if you still feel empty inside, then that's not success. But
yes,
success is when achieving goals meets with fulfillment, meets with a deep
mm,
sense of satisfaction that you are doing what is right and you are making progress in the right direction.
yes. Thank you for that. So, like to ask finally.
What advice would I like to give to my younger self? I'll tell my younger self to be happy.
Okay,
Most of the time in school, life was hard and tough. But I would just tell my younger self that to relax. God has got her. So tell God
mm,
is for you. And like your favorite saying, this too shall pass. Really,
mm,
this too shall pass. Whatever
yes,
situation, whatever condition you find yourself in, it is not permanent. Okay. And you cannot label yourself by your situation, by your circumstances. The future is bright. Okay. And God is on your side always. Keep talking
Yeah.
to God, even when it feels like you don't know what the future holds. God holds your future, and He will not fail you. He will not disappoint you. Make more friends. Make more friends. Don't just bury your head inside your books. Engage in other activities. Have fun. Enjoy yourself. So that's my advice to my younger self.
Yeah, that's very wonderful advice. Oh, thank you so much, Dr. Sarah, for being with us on the podcast. We really, really loved having you with us. And thank you so much to all our listeners for staying with us to the end. And we hope you stay tuned for our next podcast. Bye.
To wrap on today's episode of the Excellent Lady Dog podcast. If you like what you've heard, don't forget to comment, share, and leave us a review. Follow us on social media at Excellent Lady Dog for more inspiring content. Until next time, keep striving, shining, and being excellent.